today we have Dr. Rajasekar with us. He's a mountaineer and a doctor, and he's completed his MBBS back in 2009 and specializes in knee and hip injury, right? And
Knee and hip replacement.
also has trained in Sports Authority of India (SAI) for athlete rapid recovery. And that is a doctor like a medical background. And if we talk about mountains, he has already climbed Everest, Vinson Massive, Aconcagua, Elbrus, among others. Okay, so welcome, Dr. Rajasekar. And first thing, like I would like to say, is that most people think that the knee injuries are mostly of overuse uh, or sudden, but I think they are both. Like we can have overuse injuries as well as
Acute injuries
the
are
sudden injuries.
you can classify it as acute injuries which happened on the mountain and
Mm-hmm.
overuse injuries which are because of various other reasons doing it for many times. You can call it as chronic use or overuse injuries. So mainly we'll
Okay,
start
so
with the knee. And why knee gets injured? See, when
yes,
on mountain,
correct.
when you are climbing a mountain, two things are frequently injured. One is the knee and one
Mm-hmm.
is the ankle. See, thanks to the double boot or triple boot what we use, so it is totally protected so that we don't have any injury on the ankle when you go into a high altitude
Right,
climbing or when it happens only in
correct.
the low altitude and you are very casual wearing a smaller shoe, then your ankle
Mm-hmm.
tends to get injured. But right now
Right.
today we are talking about the knee injury, so we'll confine to the knee. Okay, knee injury may knee why we focus on the knee, because knee is the second most thing. If you consider as a low altitude or overall, ankle gets injury quickly. But the second thing which is injured is knee joint, and most complex one and most time taking one is the knee joint. Okay, it's mainly because of the complex anatomy what it is. See, knee joint is overall just you have muscles above and down. There are no muscle on the knee joint especially, and you can
Okay.
classify no muscles on the knee joint. See, only the joint which is not covered. See, like the hip joint, it is totally covered by muscles. Shoulder joint, it is totally covered
Yes.
by the muscles. Elbow and knee, they have very much less muscles. See, I'll
Yeah.
describe the anatomy
So
first, and then we can go to the a particular point and what is injured frequently and how to diagnose and what to do
correct.
and what not to do, how to recover quickly from the injuries. I'll tell you in detail.
Yes.
See, out of all the
Yes.
structures, we classify structures around the knee joint into three categories. One is the bones,
Mm-hmm.
the lower end of the thigh bone, upper end of the leg bone, and the small patella bone, which is in the center. Only three bones.
Okay.
Then next comes the ligaments. There are mainly
Mm-hmm.
four ligaments around the knee joints. One
Mm-hmm.
ACL, PCL, MCL, LCL. All the four are. ACL prevents you from
Mm-hmm.
going to the front. PCL prevents from going to the back. MCL to the low
Okay.
inner side of the knee joint, and LCL to the outer side. Okay, these are the four important ligaments. Then the
Correct.
tendons. Tendons connect from bone to bone, so they help in the mobility. The upper one is called quadriceps tendon. All the thigh muscles getting compressed onto and inserted onto the tibia. And the lower knee is
Right.
called patella tendon. Patella tendon, which inserts from the patella towards the tibia, leg bone. That assists in movements. And last one, the
Mm-hmm.
left, which are one all called as meniscus. They are the shock absorbers for the knee joint. When you run, jump, change movement from one position to other position, they prevent knee from
Mm-hmm.
getting injured and give a cushioning effect. These four are the structures
Okay.
what we discussed, but we are not
Right.
considering any fractures today. Because if there is a fracture,
Yes.
nobody, anyone can diagnose and anyone can treat it
Yes.
and simply rest. Either if you may require a surgery, you get a surgery, or if it heals with rest, then it is done. So fractures
Then
I am
it's
not
fine. Correct.
discussing. We'll discuss about the ligaments,
Obviously.
tendons, and meniscus today. Okay,
Yes.
ligaments of all the ligaments, ACL is the most common and most frequently torn ligament. Okay, why? Because whenever you stand, there is an acute force. When you start running and stop suddenly in a straightened knee, there is a lot of force which is falling on the anterior aspect of the knee joint, and the knee have to go, when your movement is from back to front, and this ligament is
Mm-hmm.
preventing you from going any further. So
Mm-hmm.
you are breaking the restraint. So there is sudden change of movement or sudden change in any deviation or long standing front sudden jerk load from the back to front. will cause this injury. Generally,
Injured.
see, when you're getting down from a running bus, you are in a momentum and try to stop yourselves. It's
Right.
the exact same mechanism which happens, which causes the injury. Okay,
Okay.
when
Okay.
the ACL is torn, it's very simple. It is a stabilizing structure to prevent the knee from going forward. So when you try to stand or when you try to walk, you feel like you're slipping forward.
Mm-hmm.
You feel like slipping forward. Okay, for this, what we do is just for any ligament injury, it's the diagnosis. You test how it is done.
Mm-hmm.
So you
Mm-hmm.
make the patient lie on the bed. Yes,
Mm-hmm.
you bend the knee into 90 degrees and you pull it
Mm-hmm.
forward. If you feel there is any laxity compared to the other knee joint, if it is going any forward, then you can suspect a injury. But
Okay. So,
in the,
just one like a small, I'll ask a question.
okay,
See, like let's roll it back a few notches. Since you explained about this thing, like the chronic and the traumatic injury.
yes,
So, from a mountaineering perspective, which is more dangerous for a mountaineer?
mountaineers, chronic usage. See, it depends upon the professional level. Amateur and
Mm-hmm.
new players, they tend to get injured in every climb, or if they're not very fit, if they doesn't have
Okay.
any technique, they tend to get injured. So acute
Mm-hmm.
injuries are more common in a younger level, professional level. When you become a
Okay.
senior, you train yourselves properly, and you are in this
Mm-hmm.
field for a very long time, then you have
Mm-hmm.
overuse injuries.
Mm-hmm.
Overuse injuries are two mainly. The patella, you call the patella the small. Patella getting under
Yes.
surface getting roughened. We call it as
Okay.
patella chondromalacia or patellofemoral arthritis. And the patella
Okay.
tendinosis. These two are the main
Okay.
causes. In a long term
Mm-hmm.
one, who is in mountaineering for more than 5 years, 10 years, and who is practicing for carrying their very huge loads and climbing and getting down, these two are the most common injuries. But
Okay.
this doesn't cause an acute. This doesn't restrict you on the mountain to stop. You can continue all your activity, but the main problem is your
Okay.
knee will be very much painful. That's the only complaint.
Mm-hmm.
The pain. All overuse injuries and chronic injuries will cause mainly pain and swelling. These two are the main
Mm-hmm.
complaint. But acute injuries
Okay.
will stop you from moving any further.
Moving any further. Okay.
Yes.
So, coming to the swelling part, like I've seen, like if you have a pain without swelling, okay,
You can
and if you
have
have
pain
pain
without
with
swelling and
swelling,
have
so what's the difference between the two?
see when after see initially when there is a smaller amount of injury, you have only pain. And this,
Mm-hmm.
if you tend to use the same part repeatedly with the same
Mm-hmm.
amount of pain and the disease process is aggravating, then you have swelling.
Mm-hmm.
Swelling is just
Okay.
a protective phenomena by the body to start repair process and to stop the movement. If you have a lot of swelling,
Okay.
then you tend to stop it. So it's a protective phenomenon both for the repair and to restrain the person.
Okay. And what is the most common cause of injury in mountains? Like, is it the
Mountain see,
descent or is
see,
it like
descent. See, I'll classify. I want to see injuries on the mountains are only
yeah,
two: ascent or descent.
ascent or
Okay,
descent? Correct.
ascent or descent. Ascent, if you are very careful and if you are following the Sherpa's instructions, you are well trained, the amount of injuries while ascent are very less.
Mm.
You have only two injuries, mainly the ACL injury and meniscal injury. These two are the most common injuries when you are climbing up. When you are
Climbing up.
climbing down, there are huge lot of classifications. See, because if you are not
Mm.
walking properly, if it is a chronic use, it all depends. I'll tell you. Okay, then we'll discuss, we'll just complete it. Ascent and descent injuries and then go to the other. Ascent injuries,
Yes.
while you are climbing at a smaller steps and a smaller stride, there are not much injuries. And when you tend to climb higher, a big foot, you are taking a bigger steps and a longer leap,
Mm-hmm.
you tend to
Mm-hmm.
climb a step at a higher lift, not more than your knee height. So what
Okay.
happens? You're putting your knee joint at a higher position, and you
Mm-hmm.
are trying to climb up. So
Yes. Right.
knee tends to go from straight leg to go to beyond 90 degrees, bend more, and then you are putting the entire weight on the back of the knee joint. See, in the
Correct.
back of the knee joint, there is meniscus, which is
Yes.
protecting it. So it is getting
Mm-hmm.
acutely compressed. See, because of
Mm-hmm.
this action, it's just like a squatting position.
Mm-hmm.
Okay, it has generally when you walk, if the force on the knee is one, your running will cause three times of force, and when you are
Mm-hmm.
squatting, it costs six times more force than the normal force. So when you
Okay.
are climbing at a higher steps, it causes severe
Mm-hmm.
impingement on the meniscus. The meniscus get to
Okay.
be entrapped between the upper thigh bone and the lower stabilizing leg bone. It's just like
Okay.
compression. It's like just throttling for the knee. And if it happens in any direction, then there is a tear. So mostly posterior horn, if I describe in a technical aspect, posterior horn of the medial meniscus is mostly torn while ascending, and
While
then
ascending. Okay.
while ascending. And if there is any slip, if you tend to slip down, if you fall down, or if anything happens, then you are this one. ACL also tend to get injured.
Mm-hmm.
So apart, these two are the common injuries. Apart from this, if you slide down or slip, or if anything, if you fall from 3 to 4 steps, if you are at a different angle, then your MCL, the inner stabilizer of the knee joint, also tend to get injured. Only
Injured.
these three are
Okay.
the most common. And if you roll
Mm-hmm.
back, if you fall, roll back, then there tend to be other injuries like neck injury, shoulder injuries, back injuries, and other injuries. But
Yeah.
generally,
True.
when you speak
So
only about the knee injury and a small stable one,
mm-hmm.
medial meniscus injury and the ACL injury are the most common.
ACL is most common. And
Most
what are
common.
the symptoms? Like suppose, okay, suppose we are climbing, ascending, descending, or we have a accident on mountains, whatever. So what are the symptoms which will tell us that this is serious, and which
See,
other symptoms will tell us
see,
that it is not very serious?
see, sudden onset of pain. Sudden onset
Mm-hmm.
of pain. See, you're walking normally, and there is sudden excruciating pain with immediate
Okay.
swelling. The swelling also will
Okay.
come
Immediate
within
swelling.
10 to immediate swelling. Swelling will come in less than 10 to 15 minutes. Okay. In that case, you have to suspect a bigger injury,
Come
maybe
again.
ligament injury.
In
Acute
how many minutes? Sorry.
sudden onset of injury with
Uh huh.
swelling in less than 10 to 15 minutes suggests that
Less
you
than
have
10
a
to
very
15
severe
minutes.
injury.
Mm-hmm. Okay. Okay.
Uh, okay, this is what it
And
happens.
what about the non-serious injury? Non-serious injury, the swelling will
Non-serious
come later
injuries,
on.
you just have pain, but you will be able to
Just have
carry the.
pain.
You can carry on the function. See, if it is a serious
Carry on
injury,
the function.
your activity is stopped. Severe pain and swelling, and sometimes there will be if the ligament or
Mm-hmm.
something is wrong, you can see the contusion, redness. So if you open the site and see, you can see bruising also sometimes. It is a bigger injury.
Right, right. And what is the immediate step? Okay, okay. Now we have
See
identified
immediately
that
stop.
this person is
See
injured.
immediately stop the movement, rest.
Mm-hmm. Mm-hmm.
And if there is, you can open it. Ice packing is very good. Rest, then elevation, then compression in the crib bandage application, and ice pack and medication. Apart from that, that will give. And nowadays we call it as previously it is called as rest, ice, compression, and elevation. Now we'll call
Yes,
as price, protecting,
price,
putting a splint or
protecting.
putting something on over it is called price.
Mm-hmm. Price.
These five are the important steps to prevent any further injury and help in recovery.
Okay, and about medication, as you said, so what medication should we like administer immediately? Since we are in mountains
Okay.
high up, there is
See,
no chance
if
of
you
any diagnosis
uh,
or anything, right?
you can carry a prescribed medication when you are going up. See, there is a drug called chymotrypsin, which is given to reduce the swelling. You can take
Okay.
it 3 times a day before food. It will help in
Mm-hmm.
aid in reducing the swelling. Then you have other painkillers
Swelling.
like aceclofenac, diclofenac, serratiopeptidase,
Mm-hmm.
all others. You can carry these are you can carry without prescription also. You can get it on in all the medical shops. And before going, if you are planning for any summit or any uh, trek, then you can
Mm-hmm.
carry.
Okay.
And ice
Okay. Fair
compression.
enough.
Always carry a crepe bandage,
Right.
minimum medications. And if you it is okay, you
Mm-hmm.
can carry a long splint. If you have space, you can carry a long splint. Otherwise, it's a short splint. That would be helpful.
Short splint. Mm.
Uh,
So we have to carry a splint, a crepe bandage, and medicines for reducing swelling and a painkiller, right?
yes.
These four are
Absolutely.
what we should always be carrying. And
Yes.
like so we were earlier you were explaining about ACL injury, right?
Yes.
So now let's come to ACL and MCL. As you said that ACL and MCL
Okay.
are two most common
Two
injuries
most
that
common
we
injured, and the third is meniscus, medial meniscus. These three are the most common injured
mechanisms.
fractures.
And
Okay.
one more I will add is like a few athletes that we have trained, they have like either they have arthritis or they are in the beginning phase of arthritis. So how arthritis affects training or mountaineering? That aspect also, if you can
Okay.
shed some light on.
See, when there is one more thing is ligament laxity is also one more other thing which is the most prone to common injuries. Your ligaments are loose,
Okay.
so
Okay.
your knee joint tend to move in abnormal directions. Those who have very
Mm-hmm.
loose joints also they have lot of pain in the knees because of abnormal movement at the knee joints. It cause early arthritis. Lack
Okay.
of ACL weakness or complete lack of ACL will cause early arthritis.
Mm-hmm.
Any MCL, any ligament injury will cause abnormal movement at the knee joint. So that will cause arthritis. Weak muscles, weak hamstrings or weak quadriceps and weak calf, that will cause acute lot of load on the knee joint. That will cause
Okay.
early changes in the knee joint and that may cause arthritis. These three are the most common causes for the knee pains. See, sometimes you see previously we used to see patella changes, undersurface getting roughened maybe after 30 years. But now we see
Mm-hmm.
even at 10, 12, 18, 25 also. It's because of the nutritional change and long sitting,
Mm-hmm.
reduced physical activity, reduced strengthening, and the nutrition quality is all. Now junk is more and good food, protein and calcium rich sources are decreased. See, everybody is replacing the healthy food with the easy options,
Yeah, yeah,
junk and easy. See,
always,
स्कूल को कुछ
always.
बेचना है तो पहले तिल का लड्डू या कुछ घर में वो सब बना के बेचते थे. अभी क्या कुछ बिस्किट्स खरीद के वो रख के बेच रहे. It's all because
Yeah,
of
totally,
lifestyle
totally,
changes. So
totally agreed on that part.
less strength in the
Uh,
bone, overweight, and
mm-hmm.
less reduced strength of the muscle is causing an early changes in the knee joints. The cartilage
Knee
surface is
joint.
getting softened and the size is also decreasing. So you find it difficult to train all the people. When they start training immediately, they are not
Mm-hmm.
used to so much of loading on the knee joint.
Correct.
So immediately what happens is the surface tend to get bruised. अभी देखो नया नया रोड डाले अच्छा क्वालिटी डाले तो अच्छा ही रहता. अच्छा क्वालिटी नहीं है तो एक बारिश के
Mm-hmm.
बाद कैसा होता है पूरा रफ हो जाता है ना. इट इज सेम थिंग इट हैपेंस ऑन द
Right.
इनर surface on the upper aspect of the thigh bone and the low and the under surface of the patella. So that's the
Okay.
reason when you start training for these people who has mild ligament laxity or ligament injuries, and when these
Mm-hmm.
people they have acute pain and they can't go beyond certain level of training. See, when you find
Mm-hmm.
people, some if you train for many days also, they can't pass. They will be at a 60, 70 level. They can't reach the 90 level. It's all because of the
Mm-hmm.
previous injuries. Okay.
And like see a person with arthritis. Okay.
Uh,
So can they climb mountains, or what
yes.
precautions they should take to climb mountains?
Yeah. I will tell you. See, it depends. It all depends on the. If for a person with age of 50 and previous injuries, and
Mm-hmm.
if he is in grade 3 and grade 4, no way he can do that. Only
Okay.
extraordinary extra. He is committed. He should be committed entirely to do that only. तो पूरा
Mm-hmm.
काम छोड़ के वही स्ट्रेंथनिंग काम में लगे रहे तो देन ही कैन डू दैट. बट
Then
नॉर्मल
possible.
पीपल
Okay.
for a
Yeah.
normal person who is doing normal activities, you can train a person who is in grade 1 and grade 2 arthritis and they can do well in the
Okay.
mountain also, but not those
Okay.
in grade 3 and grade 4. Grade 4 no way they
Mm-hmm.
can do that. Grade 3 also can be
Mm-hmm.
managed. I have a friend
Manage.
previously who was in grade
Mm-hmm.
3 and he climbed Everest.
Okay.
He's
Good.
into 50s. Not in Indian, he's an American, but he had grade 3 arthritis, but he managed to climb it. It's severe training. He is a very good athlete,
Severe training.
triathlon
Mm-hmm.
athlete. He has grade 3 arthritis. He got surgeries done for it also, but still managed. He
Manage.
trains
So it
rigorously
is
for every day.
possible.
So
Mm-hmm.
grade 1 up to grade 1 and grade 2 can be managed, but grade 3 and
Mm-hmm.
grade 4 cannot be managed.
Manage.
That's it.
Understood. So grade
Arthritis.
one, grade two is fairly simpler to manage. Grade three is possible, but grade 4 is seriously difficult to manage.
It's impossible. You can't manage
Impossible
in
to manage.
mountaineering. Okay.
Okay. So let's
See,
again come back to ACL. Yeah, please go
okay.
ahead.
Yes, yes. See, when you want to train them, you can train them for very long time. Maybe you can give supplements, you can add
Mm-hmm.
nutrition, you can add
Mm-hmm.
training. But these all, if you progressively increase, maybe after 3 to 6 months, they can have good results.
Good
Nowadays, there are a
results.
lot of medication. We give PRP injections, we give collagen supplements, there are collagen powder sachets. With
Yes,
apart from these are from our side, then good nutrition, good exercise, and weight reduction also helps a lot. And strength training,
helps a
mainly
lot.
strength training,
Strength training.
quadricep strengthening, hamstring strengthening, calf maintenance, and glutes. If you maintain these four, then there is less strain on the knee joint, and your knee will survive for very long.
Mhm. So basically, what I get from you is like the best answer to arthritis or any kind of knee issue is the strengthening of all of our muscle groups, good
Strengthening,
nutrition, and good supplements.
yes.
Okay, so now again, let's come back to the ACL. Yes,
Okay. Okay, ACL. How do you diagnose it? I told you, no. When there
yes,
is injury, you
yes,
diagnose it first. You have an injury,
yes.
you diagnose with just pulling the bending the knee at 90 degrees and pulling forward. If there is laxity,
Oh,
you can identify there is, and then you can go to a doctor. He will examine you, and then you can get an MRI, and then he will diagnose. Ideally,
yes.
mm, if you have a ACL injury, 90% of the times, if you want to continue into mountaineering or any rigorous active sports, you need to get a surgery done. Why? Because we
Hmm.
want to stabilize the knee joint from moving front and back.
Yes.
So that excessive movement will cause early arthritis, severe knee pain, anterior knee pain, and instability. With that, climbing a mountain, high altitude mountain more than 8,000 plus will be difficult. You can
Hmm.
maybe you can manage, but it will be very lot of difficulty and lot of
Hmm.
strain. So ideally, getting a surgery is better. See, surgery, if you do
Okay.
surgery also, it's done. Surgery will take 1 hour time. After surgery, you are made to walk on the same day.
Hmm.
You get 4 weeks of rest, but we start physio on day one only. We
Deva.
advise 4 weeks of bed rest to stay at home. From
Hmm.
from 4 weeks you can start walking. 6 weeks you can
Hmm.
start jogging. Two
Hmm.
months after completion of 6 weeks you can start swimming. After two
Hmm.
months, you can start slow jogging. 3 months, you can start
Hmm.
running and playing other
Okay.
sports activities. From 9 months, you can start playing cricket, football, basketball, and high activity like rugby, soccer.
Hmm.
After 10 months, and mountaineering also after 10 months.
10 months.
After 10 months of the
10
surgery,
months.
it's a simple surgery.
Okay.
It's done by experts. Only physiotherapy is the most important part.
Hmm.
Adequate
Hmm.
quadriceps strengthening and hamstring strengthening is the ideal thing in this. Okay.
Okay, so what I get is like ACL injury, and if you are having a surgery, so all our audience, please note that physio is most important after surgery.
Physio.
Then comes strengthening,
High
and then
protein,
comes your
high protein diet.
high protein diet, and like less in intense sports like swimming. And later on, you can increase the intensity and tempo of your sports, and it will take around 9 to 10 months before you can
And when to
actually
come back to the to
go
come back to
to
mountaineering.
mountains,
Come back to mountaineering.
come back to mountaineering. Okay, fair enough.
Okay. If the ACL
And
injury is only grade one, with strengthening,
grade one.
grade one or grade two, we can manage with only strengthening, and then you can be back after 8 weeks.
8 weeks. Okay. Only
8 weeks.
grade 3 is surgery.
Grade three we operate. Grade three and complete laxity.
Grade 3 is Mhm. Okay. So let's come back to now MCL. What about MCL? Can you explain the grades also, the difference, and then
Yes,
the
yes.
how
I'll
to
tell you.
go about?
I'll tell the in MCL. MCL is the we call it as medial collateral ligament. It's on the inner aspect of the thigh. It is the
Mm-hmm.
strongest of all the four ligaments of the knee joint. So generally,
Mm-hmm.
you tend to get doesn't get injured from the inner side. Inner side bears more weight, and inner side is very strong. So it's the strongest ligament of all the knee joints, the
Okay.
strongest, biggest, and everything. Okay, generally it doesn't get injured, but when there is
Mm-hmm.
severe force from side, it happens only when abnormal loading or abnormal force is driven from the outer aspect of the thigh to the inner aspect. Like that, when you
Right.
are trying to support your guy, when we are climbing down, you are holding, and you are supposed to you are holding, but he jumped off and pulled you suddenly. and
Yes.
there was severe force from the outer aspect of the knee joint to the inner aspect. So
Correct.
that force will cause a severe strain on the knee joint, and it doesn't
Right.
happen most of the time. It doesn't happen when the knee is straight. It happens mostly
Mm-hmm.
when there is slightly bent, maybe 30, 40 degrees or even 90 degrees. At that
Mm-hmm.
angle, MCL is little bit weak. When it is straight, it is
Mm-hmm.
locked and it is stronger.
Okay.
Okay, that happens when you have the abnormal. So you are not standing straight. You are at a bent angle and then you are supporting. So
Mm-hmm.
acute force from the outer aspect. It happens the same in soccer, rugby. Who
Mm-hmm.
pushes from out? You are pushed, and the force is driven into the knee joint. Then the MCL gets injured. It's also
Right.
same when you see immediately MCL injury. Anyone can identify. You won't be able to stand. You won't be able to walk. Okay,
Mm-hmm.
there will be severe injury. Bearing weight on the knee joint will cause severe pain.
Okay.
And when you try to walk, your joint tend to be open up and your leg will be going outside. Knee
Correct.
will be going inside and the leg will be going outside.
Going outside
Okay.
will bend towards an
Okay.
angle.
Yes.
Mm-hmm.
Grading wise, identification is easy. You keep the leg straight and try to push the knee from the outer side. Knee joint tends
Mm-hmm.
to get opened. There will be
Okay.
little bit of abnormal movement.
Mm-hmm.
Okay. These MCL injuries we classify into three types. Grade 3, 1, 2, 3.
One, two, three.
Grade 1 is
Okay.
very minor injury. When you try to push and open also, you feel very minor opening.
Mm-hmm.
But when we touch on the inner aspect of the knee joint, you will have severe pain. Pain,
Severe
swelling,
pain.
pain, swelling and tenderness. When you put a finger on the pain, you will have severe pain. That's the identifying feature.
Mm-hmm.
Okay.
Mm-hmm.
In
Mm-hmm.
grade 1, generally we give a long knee splint. Its splint is for 4 weeks or 6 weeks. And then you start physiotherapy. And by 8 weeks, you will recover in grade 1. Grade 2, there is opening. You can feel that. You can
Okay.
identify the opening. But the knee comes back to the normal position. When you give excessive force only, then only it tends to open up. But you can clearly
Okay.
identify the opening of the knee joint.
Okay.
Okay. Then it is called grade 2. For that also same treatment. But recovery takes 12 weeks.
12 weeks.
Treatment is same, but the recovery time is 12 weeks.
Mm-hmm.
Generally, these grade 2 injuries happen in associated injuries. When you have ACL injury and there's a lot of force, there will be grade 2 injury on the knee joint.
Knee
Okay,
joint.
it happens. Generally, grade 2 injuries are associated injury. When there is a ligament failure, there is excessive force on the other ligament of the knee joint.
Mm-hmm.
Okay. Then grade 3, total complete opening. When you push, the knee is open, unable to stand, unable to walk, and severe pain,
Mm-hmm.
horrible pain, contusion, everything. For this will require surgery. MCL
Yeah, surgery over
surgery,
there.
MCL surgery is little bit more painful one, and we do it mildly open and partly inside, partly open. Generally, we
Okay.
tend to reconstruct with putting the other graft also. It's a bigger surgery,
Okay.
and recovery also
It's a
takes
big
longer
surgery.
time. Yet, physio starts after 4 weeks. Generally, first 4 weeks we don't give any physiotherapy. In ACL, we start physiotherapy right from day one, so
Day
the
one,
recovery
correct.
is fast. In
Okay.
MCL surgery, we start physio only after 4 weeks. So because you are not moving the leg for 4 weeks, your quadriceps muscle, tend to be weakened. You have difficulty in walking, standing, running. Everything in recovery takes longer time, and all these are things. Or longer physio, longer time, longer pain. Everything takes a longer time. Okay.
Longer time. So MCL will take longer time to heal than the ACL.
Yes,
Okay.
MCL
Okay.
takes
Fair
long
enough.
time.
And what are the common mistakes, Rashika? Like, what mistakes after you come back from a mountain when you are like, dealing with the injury? What is the common mistake people make that elongates their recovery?
Along with neglecting the physiotherapy, neglecting
Mm-hmm.
say nutrition wise. When they come back from the mountain, they previously when they're planning for the mountaineering, they eat well, do well, exercise well. They take a lot of care. When
Right.
they come back, you eat whatever you want. You tend to get
Mm-hmm.
overweight, weight बढ़ाते, physio neglect करते, nutrition neglect करते, and the instructions what to do and what not to do are all neglected. These are the main things.
Mm-hmm.
See, only discipline. What is to be followed should be followed every day, same day. Eating well, eat good nutrition, less carbs, more
Right.
nutrition, more immunity wala food.
Mm-hmm.
Physiotherapy is compulsory, and doctor visit. Whatever doctor says, you have to follow. These are the four important structures for the early recovery. If you're not following this, then really what happens is when you come back, when you feel it is a minor, see, 2-4 हफ्ते में दर्द कम हो जाता. You feel like
Right.
you are recovering and you tend to start jogging, running, everything. So you tend to push abnormal weight before recovery. So that will cause early injury. Okay.
So now we have discussed ACL, MCL, arthritis. Any other injury or any other issues with the knee joints that are common or be
See,
mountaineers should be careful about?
meniscus injury, the third thing. The
Mm-hmm.
third thing is meniscus injuries. See, meniscus, I told you, no,
Okay.
meniscus happens, injury happens when you're going up and when you're coming down. See, when you're
Okay.
coming down also, we didn't discuss all the injuries which are while happening while coming down. I'll tell you the
Okay.
meniscal injury. What happens is, see, when there is
Mm-hmm.
abnormal force and you tend to rotate the knee joint, you're moving in a
Okay.
cross manner, then the meniscus are locked in between both the bones, and then
Mm-hmm.
they tend to get injured. Okay, when you're going up, when you're climbing at a bigger strides and longer step length, then it gets
Mm-hmm.
tend to get injured. When you're
Okay.
coming down, when you're putting a longer straight step, when you're coming down, when you're coming down and when you tend to slip, you put the lock the knee joint straight. At
Mm-hmm.
that time,
Right.
what happens is it gets entrapped in the front aspect.
Okay.
अभी जब नीचे जा रहे हैं ना, now the lateral meniscus. Previously, posterior horn of medial meniscus was injured. Now anterior horn
Mm-hmm.
of lateral meniscus tend to get injured. They tend to get
Okay.
crushed in between, and there
Correct.
will be a tear.
Mm-hmm.
These are very painful. See, when this happen, meniscal injury happens at a bigger stage. Generally, it's like C shape, and sometimes
Okay.
half of the C is also torn, and the fragment comes inside and gets locked in between. It's called locked
Okay.
meniscus. Then you tend to your movement. There is no movement in the knee joint. You can't bend the knee and your knee joint gets locked in a particular position, and you can't walk, do anything. This is called locked
Okay.
meniscus or locked knee. It's an
Mm-hmm.
emergency maybe, or this is very important how to treat it. So what you do is you make the patient lie on the floor or wherever you
Mm-hmm.
possible, and then what you bend slowly, lift the leg and bend it further more how much ever you can do. Then what you
Okay.
have to do, you have to pull the leg, you have to give traction, and
Mm-hmm.
then rotate the leg outside,
Mm-hmm.
and then rotate the leg inside. If you can
Okay.
if you can able to do that, the meniscus which is locked in between both the bones tend to get released. If the maneuver is
Okay.
successful, again he will be able to walk.
Walk.
But this may happen, but this locking sensation may happen in between again and again also. For some people, see,
Mm-hmm.
50% it may happen again, and 50% it may not happen again.
May not happen again.
May not
So
happen.
meniscus is also a pretty serious injury if it happens in mountains.
Yes, if it happens, it will be very painful and very serious injury.
Okay, and what is the immediate line of treatment in the
Immediate,
mountains? Once you reach
see,
the hospital, okay, I can agree.
if you can put a long knee brace, he can walk. You should not bend the knee
Okay,
joint. Without bending the
okay,
knee
we
joint,
need
you
a
can lie
brace
on.
and you walk.
If
Okay,
you if
fair enough.
you see, if you can keep the leg in straight position, maybe after 4 hours or 6 hours, your pain also tend to come down,
Okay, so
and
it's
he will
just
be
the
able to walk in
meniscus.
straight.
Meniscus, it's important that we have to keep the leg straight.
Leg straight. That's it.
Mhm.
Okay,
Okay, okay.
and
So I have
rare
few more questions. Yes, please.
okay, and some rare injuries while
Mm-hmm.
coming down. Those who have loose ligaments also, loose ligaments with
Mm-hmm.
improper muscle imbalance. Sometimes what happens? Thigh inner muscles are weak and thigh outer muscles are strong. Then when you're coming
Okay.
down, when you try to contract, when you try to control the movement, what happens is in a straight leg, the outer muscles tend to pull it out. So in those situations, you will
Okay.
have patella dislocation also. Patella
Okay.
coming out from its normal joint, थोड़ा बाहर निकल के आता. Then also they'll be
Okay.
unable to walk.
Mm-hmm.
The treatment also
Understood.
same. Extend the knee joint and push it. If you are able to reduce the patella back into the joint, put a long knee brace, and then you can walk further.
Okay.
This
So
is it.
for mountaineer, I think as I have understood that we need to carry like braces prep bandage, medicine for pain relief, and to reduce swelling. Right.
Yes.
Okay.
Yes.
So now these are like just rapid questions, and then
Okay.
we will wrap it up. So what about knee brace? A person who has, should he use knee brace or not?
What is the problem? See, knee braces are two types. One the soft one,
Okay.
kneecap. We call it as kneecap.
Yes, kneecap. You're right. Yeah.
Kneecap. Kneecap, when you are walking, running, you're climbing up or climbing down, you can wear it. But when you're sitting idle, if you wear it and sit, there will be swelling. Your blood flow will come down slow. So your legs tend to get swollen. If you are comfortable
Mhm.
wearing the kneecaps and walking, then only you can wear. Knee brace is different. Knee brace is with rods.
Okay.
Oh, okay. Knee brace is with the rods. वो वाला दो तरीका से वह hinge knee brace. One one which you can flex the knee joint. एक
Okay.
रखने का. और
Mm-hmm.
long knee brace when the acute injury. वो hinge knee वाला brace after recovery you tend to wear that. But
Okay.
if
So
you are
knee
wearing a
brace.
rods वाला belt ले रहा है तो it's difficult to do mountaineering. Only the
Okay.
kneecap. You
Understood.
you can wear kneecap and do a smaller treks or bigger treks also, but not in
Mhm.
high altitude mountaineering. Generally, people don't wear kneecaps.
Okay. So yes, this was a common query, like about kneecaps. So yes,
Okay.
we should not use it in very high altitudes and all.
Why?
Okay.
Why? Because it's
So
decreases the pool blood flow.
blood flow. Right. And what about ice? Should we use ice?
I said
But you can understand, like we are at a very negative temperature and all. How will that impact?
so how it all depends upon contact for only some duration. See, you won't be
Some
keeping
duration.
for much duration. Just you will be
Mm-hmm.
putting for some. Just you take in a plastic cover, just apply for 1-2 minutes, and then
Mm-hmm.
take it off, and then you can do it for multiple times.
Okay.
See, if it happens in
Okay.
my high altitude, maybe above 8,000, and it temperatures are below -30, no need to put an ice pack. Ice pack application is
Okay.
only valid when the temperatures are plus the temperatures only. Generally, if it is
Okay.
so
Okay.
cold, then ice pack is not required.
Not required.
If you
Okay.
have a
Fair enough.
facility and if you can do that only, then only. Generally, when the temperatures are plus only, you put ice pack. If the temperatures are minus,
Ice
maybe
pack.
below -20, not it is not required and not advisable to put an ice pack.
Not advisable. Okay. Okay. Okay, fair enough. That is it from my side. And what I've understood is that, like, a knee injury in mountain is not just an injury, it's like a mobility issue. So we should take care of it and stay safe
We
all
should
the
not
time.
neglect to see. Don't
Yes,
overthink and
we should
don't
not
over and
neglect.
don't underestimate about the injury. Never take things
Mhm.
lightly. See, if it
Never take
happens
things
when
lightly.
if it happens when you are climbing up, it is better to stop. Why? Because continuing further may still progress the injury, and maybe one season loss will be converted into the entire stopping of the career.
Yes,
This is
absolutely,
something
absolutely. That's
if it is a small injury and partial injury, if you continue further and going up, then there are high chances that it will be converted into a complete tear, and it will be very painful. And you bringing back and coming back is also, and rescuing is also will be very difficult if the injury progress.
mhm.
So
Right,
always
absolutely right.
better to take a back step when you're going up. When you're coming down,
Okay,
obviously you're coming back. So people will help you and you can
right.
come back. But never,
Hmm.
if a major injury happens to the knee joint while going up, always stop the ascent. Please come back.
Come back. Right. That's the yeah. That's the thumb rule in mountains that any injury, anything happens, the first step is stop going up.
Yes.
Okay. If anybody, I think, wants to ask any question, we can wait 1 minute and then we can wrap it up. Okay. Okay. I think we are done. Thank you, Dr.
Okay.
Rajasekar. Thank you very much.
I'll just few tips.
Yes, sure.
See, you in the beginning of the career use trek poles so that either climbing up or climbing down, it will reduce the load on the knee joints. Always strengthen hamstrings, quadriceps, calf, and glutes, so that it will reduce the strain on the knee joints. Core is compulsory. Okay, and back strengthening and resisted band strengthening. These are very two
Yes.
important and should be done compulsory.
Right.
Good nutrition, adequate rest, good exercise, and strengthening. This will help you in achieving your goal. Thank you.
Absolutely. Thank you. Thank you very much
Thank
for
you.
your time. Thank you.
Thank you.